Get ready to learn everything you need to know about metformin side effects and how you can avoid them. What is metformin? Metformin is a drug that you take by mouth to bring down blood sugar. It's the most commonly used drug in adults and children over the age of 10 years with type 2 diabetes. How does it work? Metformin works in several different ways. First of all, it reduces your appetite. It also delays the emptying of your stomach after your meal, and these two can be particularly useful if you're trying to lose weight. Metformin reduces the amount of sugar that's absorbed from your gut into your blood when you eat food that contains carbohydrates. It reduces the amount of sugar that your liver produces and pushes into your blood, and it makes your cells more sensitive to the effect of insulin. This means that when insulin comes to your cells, knocks on the door and tells them to open up and take glucose out of the blood, they listen. So they open up, let the glucose in, and your blood sugar comes down. So let's talk about side effects. All drugs have side effects without exception. And you might be asking, when we know that metformin has such horrible side effects, why do we keep prescribing it? Whenever we prescribe, we're weighing the benefits of the drug against the potential side effects of that drug. So if you came to me with a headache because you didn't get a good night's sleep, I wouldn't say to you, here, take this drug. It will give you blurred vision, crippling stomach cramps, and you won't be able to walk for 2 weeks, but it will definitely cure your headache. You'd think I was daft. Doesn't make sense, because in this case, the side effects far outweigh any benefits you might get from that drug. I would tell you to perhaps take a mild painkiller and definitely go get some sleep. Another reason why we keep prescribing metformin is because we've been using it to treat type 2 diabetes for decades. It's the most studied and well-known drug that we have to treat type 2 diabetes. And again, you can get metformin almost everywhere. It's widely available and relatively cheap compared to other anti-diabetic drugs, especially the newer ones, which a lot of people can't afford or it's not covered by their insurance. When you start taking metformin, yes, you might get side effects, but there are a couple of things that you should keep in mind. First of all, the higher the dose, the more the side effects. Second is that you may not have any side effects at all. There are people who've been taking metformin for over 20 years and they are perfectly fine. Then you may have some side effects, but they subside gradually over time. And they may come up again when the dosage is increased, and then they'll subside again with time. And then you might belong to the group of people for whom metformin just doesn't work. And it doesn't matter what you do to try and minimize the side effects, you just can't tolerate it. And who is more likely to have side effects from metformin? If you have liver disease, if you have kidney disease, and if you have heart disease, you're more likely to experience side effects. So I'll talk about the more common side effects of metformin first. Whenever you're taking anything by mouth, any drug that you swallow, the gastrointestinal side effects are going to be right up there at the top of the list. So we're talking nausea, vomiting, stomach pain, constipation. You may feel very gassy and bloated, so you find yourself burping and farting a lot. But one gastrointestinal side effect that really gets people is explosive diarrhea. And it can be so bad that some people won't take metformin if they're going to leave the house so that they don't have an accident on the way. And maybe 30, even up to 50% of people who take metformin may have some degree of diarrhea. You may get an unusual taste in your mouth, which some people have described as being metallic. You may get a sour taste in your mouth, especially if you're having acid reflux, and some people have completely reduced taste. Another side effect you might experience is general weakness and also muscle pain. You may also feel dizzy, which can be as a result of postural hypotension. That's low blood pressure related to your posture, and this can be caused by metformin. So usually what happens is that maybe if you're sitting down and you stand up, your blood pressure is supposed to rise ever so slightly so that you get enough oxygen and nutrients going to your brain. When this doesn't happen, then you feel dizzy. And this is particularly troublesome in the elderly who may already have problems maintaining their balance. Metformin rarely causes hypos, that's low blood sugar, but it can in the following situations. First of all, if you take metformin without eating, if you're using it in combination with other drugs that lower blood sugar, if you do vigorous exercise after taking it, and if you drink a lot of alcohol while you're taking metformin. Metformin can also reduce absorption from your gut of some minerals and vitamins like B12, folate, and calcium. These deficiencies may develop within a few months of starting metformin, or they can take years to develop. B12 has many functions in the nervous system, that's the brain and the nerves, and a lot of the signs and symptoms of B12 deficiency can exist together with or resemble signs and symptoms of diabetic neuropathy, and I'll link to some videos about that in the description. So it's important to detect this B12 deficiency as early as possible, because the negative effects of long-term B12 deficiency cannot be reversed. So continuing with the side effects, some of the less common ones are chest pain. You may be more prone to infections of the nose and throat, and you may also have a persistent cough. You may also have profuse sweating and headaches. So how do you prevent the side effects of metformin? One of the best ways to avoid side effects with metformin, especially if you're just getting started, is to ease into taking it. So that would mean that you would start with 500 milligrams at night. And the reason you're taking this at night is because if you do have any discomfort from it, hopefully you should sleep through it. And then you will take this 500 milligrams maybe for a week. If you don't have any problems, then you would add 500 milligrams in the morning and then take that for a while. So your dose of metformin would increase gradually, stepwise, until you reach the maximum dose. Another option for reducing the side effects of metformin is to use a different kind of metformin. The regular metformin, what happens is that when you take it, it starts being released immediately and you get like a surge of metformin into your system. There's another form of metformin which is known as the slow release or extended release form. With this preparation, metformin is released gradually into your system, so you don't get a dump of metformin, and so you'll have fewer side effects. Another very simple way to avoid side effects from metformin is to never, ever, ever take your metformin on an empty stomach. Just don't do it. Wait for about 15 minutes after you finish eating and then take your metformin, and you'll find that this will make a huge difference in the gastrointestinal side effects like nausea, vomiting, and stomach pain. Lactic acidosis is a rare but life-threatening side effect of metformin. Symptoms and signs of lactic acidosis include nausea, vomiting, diarrhea, fatigue, muscle pain, altered mental states, that's you might not know who you are, where you are, and what time of day it is, and you may have shallow breathing. And who's at risk of developing lactic acidosis? If you're elderly, if you're using a high dose of metformin, if you have decreased kidney function, if you have any kind of infection, if you're actively taking alcohol while you're taking metformin. This also increases your chances of developing lactic acidosis. Also related to lactic acidosis, another area where you need to be careful when you're taking metformin is when you're doing certain x-rays and CT scans. For some of these investigations, you may need to be injected with a contrast medium containing iodine. And what this contrast medium does is that it highlights certain parts of your body. For instance, your urinary tract. If you have decreased kidney function, that's a GFR, glomerular filtration rate. Try saying that 3 times without biting off your tongue. So if you have an estimated GFR of less than 30 mL per minute, you may have to stop taking your metformin before you do these tests. The trio of decreased kidney function, the contrast medium used for the test, and metformin greatly increase your risk of developing lactic acidosis. After 48 hours, if your doctor checks your kidney function and thinks that it's okay, then you'd be able to go back to your metformin. Remember that I said that one of the ways that metformin works is by reducing the absorption of sugar from your gut into your blood. And also remember that the higher the dose of metformin you're taking, the more likely you are to have side effects. So one strategy you can use is to reduce the carbohydrates in your diet. That way you may be able to reduce the dose of metformin that you have to take. And for some other great alternatives that you can use instead of metformin, watch this next video.